Good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We're here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce qu'on vous invite à poser votre question. Today, we will be hearing remarks from Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, followed by Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, and Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Dr. Trevor Arneson, Associate Medical Officer of Health, Ottawa Public Health, médecin adjoint en santé publique Ottawa, and Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, gestionnaire d'immunisation, santé publique d'Ottawa. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Councillor Keith Egli, Chair of Ottawa Public Health Board. Le conseiller Keith Egli, président du Conseil de santé d'Ottawa.
Thank you, Kina. And Quay, bonjour, good afternoon to everyone. Thank you for joining us today. It's a little bit later than we would normally do this, but here's our latest update on COVID-19 in Ottawa and the vaccine rollout. We know people are eager to receive a COVID-19 vaccine, and many are wondering why vaccines are being delivered to specific age groups in a few neighborhoods of the city and are not widely being offered at this time. Simply said, there is not enough for everyone who wants a vaccine at this time. The distribution of the vaccines is still heavily dependent on vaccine supply. That is why the city and Ottawa Public Health are working to vaccinate those at the highest risk of hospitalization and death first. Delivering the vaccines to these communities and age groups will provide protection to those who are the most vulnerable from hospitalization and death as a result of COVID-19. OPH is committed to using an evidence-based approach to vaccine distribution. This means using local data provided by the Ottawa Neighborhood Study, along with several other factors, including rates of COVID-19 in the community, to determine the neighborhoods for pop-up clinics. We know that the rates of COVID-19 in the neighborhoods where residents are at the highest risk of the virus are on average 5 times higher than the rest of Ottawa, and in some cases, they are 16 times higher. And risks for hospitalization and deaths are also higher. We would like to thank everyone for their continued support with this approach. Reducing the number of hospitalizations from communities most affected by COVID-19 helps to protect everyone in Ottawa. By protecting those most at risk and by reducing transmission of the virus, we are helping support our healthcare system. Pending vaccine availability, vaccines will be rolled out in the coming weeks to more neighborhoods where residents are at the greatest risk of COVID-19. We are encouraging all of those who are not yet eligible for the vaccine to follow the City of Ottawa and OPH websites and social media channels for announcements. Please keep an eye on the local news media as they're important partners in helping get this information out to you. If you are unsure if you are eligible for vaccine at this time, please visit Ottawa Public Health's COVID-19 vaccine eligibility screening tool located on Ottawa Public Health's website. Do not call the phone number listed if you are not eligible. Please help us keep the phone lines open for those who are eligible. Phone line staff are unable to make any exception to the eligibility of those listed on the screening tool. OPH and the city are working tirelessly to distribute the limited number of vaccines equitably within the city. Once more vaccine is received and the community clinics are open, residents will be able to book their appointments online. This will help avoid crowding at clinic locations, make vaccination process as comfortable as possible. As Dr. Etches will discuss, we are not yet out of the woods. especially regarding the new variants of the virus. The virus continues to spread in our communities, and new cases are being identified every day. We need your continued support in cooperating with public health when you've been in contact with someone who has tested positive for COVID-19. If you have been contacted, please adhere to the public health advice provided by staff. It has been a long winter, and we are all looking forward eagerly to spring. Over the duration of the pandemic, and even before COVID-19 was on our radar, you've heard OPH promoting various resources to support your mental health. Well, last week, various organizations across Eastern Ontario devoted to mental health launched Access MHA, a new single point of entry into Eastern Ontario's system of care for mental health, substance use, and addictions. Anyone who is 16 years of age or older can fill out a form at accessmha.ca and book a time for a confidential conversation with a mental health and addictions professional. That professional will work with the client to assess their needs and goals, then connect them to the service that is the best fit for them from a network of partner organizations across the community. Services might include individual and group counseling, psychotherapy, psychiatric consultation, substance treatment programs, or peer support. I'd like to acknowledge and congratulate the work of our partners in this important milestone in the Ottawa Community Action Plan in providing better access to mental health and addictions services at a time when these services are needed the most. And as always, you can find more mental health resources on ottawapublichealth.ca. Thank you, everyone in Ottawa, for your continued support. I'm now going to turn over the mic to Tony DeMonte.
Thank you, Chair. Good afternoon, everyone. Bon après-midi tout le monde. I'd like to begin with an update on the vaccination process for our 80 years and older residents and adults receiving chronic care at home. I know a lot of information has come out about vaccines lately, and it can be a lot to absorb. J'ai conscience que beaucoup de renseignements ont été publiés récemment sur les vaccins et qu'il y a beaucoup à assimiler. I want to ensure that everyone has a clear and correct information so they understand that when they are eligible to receive COVID-19 vaccine. As the province recently announced, adults born in or before 1941 are now included in Part 1, Phase 1 of our vaccination rollout. However, given the limited number of vaccine supply, immediate access to all residents in this population group is not possible. Cependant, étant donné l'approvisionnement limité de vaccins, l'accès immédiat à tous les résidents dans ce groupe de population n'est pas possible. On Monday, we announced that bookings to receive COVID-19 vaccine are available for residents who were born in or before 1941, so those 80 years and older, as well as adult recipients of chronic home care and who live in the following communities: Emerald Woods, Hetherington, Ledbury, Heron Gate, Ridgemont, Riverview, and Sawmill Creek. Again, to be clear, you must be a resident in one of these communities to be eligible to receive a COVID-19 vaccine starting on Friday, March 5th. Je répète que ça soit bien clair, que vous devez être un résident de l'un de ces communautés pour être admissible à recevoir un vaccin de la COVID-19 à compter de vendredi le 5 mars. As we have limited supply of vaccines, our colleagues at Ottawa Public Health have done an extensive review to determine communities that are at high risk of COVID-19 transmission so that these vaccines can be prioritized in these areas. To serve these residents, we are setting up pop-up vaccination clinics in the communities mentioned, where the risk of contracting COVID-19 are the highest. Rates in these neighborhoods are, on average, 5 times higher than in the rest of Ottawa, and in some cases, 16 times higher. We understand that everyone is eager to receive their COVID-19 vaccine. However, we need to remain patient. Nous comprenons que tout le monde a hâte de recevoir son vaccin contre la COVID-19. Toutefois, la patience est de mise. If we limit hospitalizations in these communities, This will not only benefit the residents living there, but will also help our entire community and all residents by ensuring that our healthcare system is not overwhelmed. On Monday, we identified 3 community centers for the initial pop-up clinics. They are the Albion Hetherington Community Center, the Sawmill Creek Pool and Community Center, and the AMA Community Center. We have also just added a 4th location at Greenboro Community Center. It is important to know that residents who meet the requirements and live in one of the identified areas must book their appointment in advance. Walk-ins cannot be accepted. Nous avons également ajouté une 4e emplacement, soit le centre communautaire Greenboro. Il est important de savoir que les résidents qui répondent aux exigences et vivent dans un des secteurs désignés doivent prendre rendez-vous à l'avance. Les personnes qui n'ont pas de rendez-vous seront refusées. Residents are encouraged to complete the COVID-19 vaccine eligibility screening tool on ottawapublichealth.ca to confirm they are eligible for vaccination before calling to book an appointment. We are asking residents who are not eligible for this week's vaccine pop-up clinics not to call the booking phone line, as it is only for eligible residents. Nous demandons aux résidents qui ne sont pas admissibles aux cliniques de vaccination cette semaine de ne pas appeler cette ligne téléphonique réservée seulement aux personnes admissibles. As of the end of day yesterday, we had received 2,308 calls and scheduled 695 pop-up clinic appointments and 365 appointments for the Wabeno Clinic at Saint Laurent. Please help us keep these phone lines open for only those who are eligible for the vaccine. Aidez-nous à garder les lignes téléphoniques libres pour ceux et celles qui sont admissibles pour recevoir le vaccin. Sites for pop-up clinics are accessible, and the City and Ottawa Public Health are making accommodations for residents who need help with accessibility. We know it may be difficult for some residents to get to pop-up clinics, so we are encouraging residents to make a transportation plan in advance of their appointment. This is important. Please make sure ahead of time you have arrangements to get yourself to your appointment. Il est important d'avoir pris les dispositions nécessaires pour vous présenter à votre rendez-vous. We encourage residents to work with family, friends, if feasible, or book paratransport. Another option is the Ottawa Community Transportation, which has stepped up to help residents who can't access the clinics. They are a network of community partners who are providing transportation to and from the pop-up clinics. Eligible residents will be given information on how to book this service when they call to book their appointment, if required. Vaccinations will be rolled out to more neighborhoods when of risk rather of the for COVID-19 in the coming weeks. So we're going to continue down our list. Au cours des prochaines semaines, les vaccins seront disponibles et déployés dans les autres quartiers les plus élevés. Going forward, we will be announcing the location of the upcoming pop-up clinics every Monday as we continue to the additional high-risk communities. As for next steps, community clinics are expected to open for all Ottawa residents who were born in or before 1941 or who are adult recipients of chronic home care when there are enough vaccines available in Ottawa. We are expecting this to happen later in March. However, if there is enough vaccine supply, community clinics will open sooner. Toutefois, si les quantités de vaccins sont suffisantes, les cliniques communautaires pourront ouvrir bientôt. Further to the announcements Canada has now received AstraZeneca vaccine, the province will determine where it will be distributed, and we will be advised that this additional vaccine will become part of our inventory here in Ottawa. Ottawa is ready to deliver vaccines to residents, but our rollout plans depend on supply. That is why it is important that we keep you informed. You can do this by visiting ottawa.ca or ottawapublichealth.ca, following the City and Ottawa Public Health social media channels, and following your local news media. As you know, we have completed first and second doses for all eligible residents in the city's long-term care facilities and first doses in retirement homes. I'm pleased to say that we now have started vaccinating residents in congregate care settings, serving seniors, and we will be starting in shelters as well this week. The vaccination in our city shelters will be led by our partner, Ottawa Inner City Health. Les vaccins dans les refuges de la ville seront organisés par notre partenaire, Ottawa City Health. Finally, before I close, I want to address some of the questions we've been receiving about terminology. To recap the delivery models I announced last week at Council. There will be 7 community clinics that are fixed locations distributed geographically across the city, which, coupled with the existing clinic at the Ottawa Hospital and an additional clinic coming soon to the Queensway Carleton Hospital, we will have the capacity to deliver 308,000 doses per month. As we wait for more vaccine, pop-up clinics are now being set up as a targeted strategy to protect those most vulnerable living in high-risk communities. We are working with partners like Inner City Health to allow them to vaccinate the homeless population in shelters, as they have established relationships with these individuals. We also have partnered in supporting groups like Wabano that work with Indigenous members of our community to vaccinate that population in a culturally appropriate manner. As we did in our long-term care and retirement homes, we will be deploying our mobile vaccination teams to hard-to-reach and rural areas of the city. Comme nous l'avons fait dans les foyers de soins de longue durée et dans les manoirs de retraite, nous déployons également les équipes de vaccination mobile dans les zones éloignées et rurales de la ville. In addition, we have received inquiries regarding a drive-through vaccination locations. I can tell you that staff continue to assess the feasibility of a drive-through vaccination model, appreciating certain logistic considerations, such as the need to monitoring for adverse reactions from the vaccination for 15 minutes post-immunization. Again, all these models assume significant and sustained supply of vaccines, and we're not quite there yet. In closing, I want to recognize the team effort of the hospital CEOs and their staff, the leadership of our medical officer of health and the public health team, and the city's emergency operations team and all the city departments that have and continue to support us in our efforts. En terminant, je remercie chaleureusement tous les employés qui travaillent sans relâche pour administrer les vaccins. Ottawa is ready, and when we receive significant supply of vaccine, each of these strategies will be implemented with the objective of vaccinating everyone that wants a vaccine and protect our community as soon as possible. Merci beaucoup, thank you very much. And now I'll pass the mic over to our Medical Officer of Health, Dr. Vera Etches.
Thank you, Mr. Demonte. Bonjour. Hello, everyone. Quay. As Mr. Demonte mentioned, we are now working to vaccinate residents in congregate care settings that serve seniors, such as hospices and those in shelters. COVID-19 has had a significant impact on Ottawa's shelter systems, with all shelters having now experienced an outbreak, and 1/4 of the clients, about 220 people, having tested positive for the virus since mid-January. So the upcoming vaccination of shelter clients is tremendous news for people living and working in shelters. There is an estimated 860 shelter clients who will be vaccinated starting this week, again by Ottawa's Inner City Health, working with Ottawa Public Health. La vaccination à venir des clients des refuges est une excellente nouvelle pour les personnes qui vivent et travaillent dans les refuges. Environ 860 clients de refuges seront vaccinés à compter de cette semaine par Ottawa Inner City Health en collaboration avec Santé publique Ottawa. And we will continue to work with the city, with shelter operators for people experiencing homelessness, and Inner City Health to manage and mitigate any COVID-19 outbreaks that remain. Ottawa remains in the orange restrict zone according to the latest trends in our monitoring indicators. And our goal is to reduce COVID-19 rates to be able to move to fewer restrictions under the provincial framework and less pressure on the healthcare system. However, rates are no longer declining, and we are close to red category thresholds. The wastewater signal in particular has been increasing for over a week, and it's suggesting that more people are shedding the virus, perhaps unknowingly, posing a risk of transmission to others in those asymptomatic infections. Cependant, les taux ne diminuent plus et nous sommes près du seuil de la catégorie rouge. Le signal relatif aux eaux usées en particulier augmente depuis plus d'une semaine, ce qui laisse entendre que plus de personnes excrètent le virus, ce qui pose peut-être, sans le savoir, un risque de transmission aux autres. So I want to continue to thank Ottawa residents for working hard to keep numbers at a manageable level. And I also need to stress, we must not let up our actions that prevent COVID-19 transmission. We need to keep the protective measures currently in place to protect people from severe illness and death. So yes, vaccination of populations most at risk is underway. And every day we're turning a page on the COVID story, but we're not at the end yet. And as we wait for more vaccines, we see the presence of more transmissible variants in the community. En attendant plus de vaccins, nous constatons la présence de variantes plus transmissibles dans la communauté. So the number of people positive for COVID-19 who've been confirmed by genetic sequencing to have a variant of concern remains 10. However, the number that have screened positive for that initial genetic indicator of a variant of concern has increased over the month to 73 in total. These screen positives are likely to be confirmed as a variant of concern when the genetic sequencing is complete. And that would give us a total as at least as high as 83 people with a variant of concern. The stricter we are with our preventive behaviors, the better we can avoid a rapid rise in all types of COVID-19. So all of us, including those who have been vaccinated, need to keep up with the measures we know stop transmission. Sticking to your household contacts, maintaining a distance from others, wearing a mask, and washing your hands. If you do decide to visit with people outside of your household, there are ways to reduce that risk of transmission. Staying outdoors, maintaining distance, and wearing a mask, and keeping visits short. So again, I want to thank people who are adhering to isolation and case management instructions. If you're contacted by a public health nurse because you tested positive for COVID-19, or if you're a close contact of someone who tested positive, please do adhere to the advice the public health nurse gives you. Si une infirmière en santé publique communique avec vous parce que vous avez obtenu un résultat positif au test de la COVID-19, ou si vous êtes en contact étroit avec une personne qui a obtenu un résultat positif, veuillez suivre le conseil de l'infirmière en santé publique. If you have questions or concerns, contact your nurse. They are there to support you. Each time someone who's a high-risk contact stays isolated, they're helping to prevent the COVID rate from growing in our community. And as a reminder to parents and guardians, daily screening is required before sending children to school. If your child or anyone in the household has one symptom of COVID-19, testing is strongly encouraged. And before and after school and on weekends, all family members will help prevent COVID transmission by limiting close contacts with people outside of the household. My thanks to workplaces also who are ensuring daily screening of all employees. And access to test results for people who are checking whether their symptom is caused by COVID-19 or not. When testing at an assessment center, it continues to be speedy, with 71% of results reported in less than 24 hours, and 96% of results being reported in less than 48 hours. As always, we're continuing to provide the public with updates about how Ottawa's doing based on our local indicators, and there's metrics on our daily dashboard at ottawapublichealth.ca. But speaking of our dashboard, and because I know many of our media partners keep a close eye on those numbers for your daily reporting, over the next few weeks, you might notice some minor and temporary visual changes while we migrate to the provincial case and contact management reporting system. Pour le tableau de bord de la COVID-19 au cours des prochaines semaines, Vous remarquerez peut-être des changements visuels mineurs et temporaires pendant la migration vers le système solution de gestion des cas et des contacts. Starting March 10th, some graphs will be unavailable for approximately 6 weeks, including the source of infection graphs and contact tracing metrics. But rest assured, this information will continue to be tracked during case management, and it will be available on the dashboard again once the database migration is complete. The migration will create efficiency that will allow Ottawa Public Health to be connected with the provincial database for all Ontario cases. And we can tap into a wider network of provincially trained staff and lean on centralized software development and management. So Ottawa Public Health has continued to make additions and improvements to our dashboard since it was launched last spring, and it will continue to evolve and adapt according to public need. So thank you in advance for your patience. We're getting a little bit closer to the end of this pandemic every day. And Ottawa, I want you to know I'm very hopeful. I'm very, very encouraged by the vaccine news that continues to advance every day. I just look at the wastewater trend and I'm concerned. We don't want to go through this again, and we don't have to. We do have many months of work ahead of us, but we're not helpless. We should not feel helpless. We know what to do to prevent transmission while we wait for those vaccines to be ready for the general public. We've actually gotten through a year of this pandemic, and 85% of the population has avoided getting COVID-19. So let's not let our guard down now. We will see this through. Thank you. Merci, amigos.
Thank you very much, everyone, for your remarks. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question de suivi et une question. Again, a reminder to remain on mute until I invite you to ask your question. So we will now go to Nicole Williams at CBC Ottawa.
Hi there. My question is, I'm wondering if there's a plan for, I know that you're rolling out the vaccine for those in shelters, but is there a plan to roll out the vaccine or any kind of plan for street outreach for those who may not be registered with a shelter but are still experiencing homelessness?
I can't speak for Ottawa Inner City Health, but this is part of the population that they serve, and everyone is connected. So this would be part of the concern and part of the desire to protect everyone who is homeless.
And I'm wondering if exactly how you plan to. I know you're speaking about a first dose right now, but could you be specific or give us a few more details about when those in shelters might be able to get their second dose?
Question of when should the second dose be given is really under consideration right now at all levels. So I think the National Advisory Committee on Immunization is looking at this question, and we'll be looking to them to be able to follow their advice based on expertise and their constant review of the evolving evidence around the interval between first and second doses. But Inner City Health is used to serving the homeless population and does keep medical records to be able to do follow-up with people, and that is part of what we would expect to be able to reach people with a second dose when the time is right.
Thank you very much. Moving on, we will go to Eric O'Brien at City News Ottawa.
Thank you. So I'm going to follow up on that, actually. So from what I understand, maybe Mr. DeMonte can answer this question. You're not holding any vaccines. You're trying to get the vaccines in phase 2 at least out to as many people as possible. You're not holding second doses.
No, currently we're not holding second doses, and the reason we're not doing that, one is to maximize our effectiveness and get out in the community, but we are starting to see we return back to regular deliveries and confirmed amounts that we're starting to have more confidence. And I'm encouraged by what we're hearing from senior levels of government that we will start seeing significant amounts of vaccine arriving. So as I mentioned in our plan, the team we can turn the switch on to be able to vaccinate more people based on what we're receiving with some of our models. So absolutely not, we're not holding anything back, and we're using everything we have. The fridges are bare once the week is over, and we're looking forward to getting our next batch the next week.
You mentioned AstraZeneca and being approved now, and then you should have more details from the province coming out soon. How do you see it being used in Ottawa?
So I'll let Dr. Etches chime in, but to be clear, it just arrived on Canadian soil. I think it was today, and the federal government's now coordinating with the provinces to distribute the AstraZeneca vaccine. And then the province, with the amount that they're going to get, are currently looking at what they want to do with the first batches that they get and what they're going to target. So we'll be hearing that over the next couple of days. But I imagine in the future as we go forward. But I know your question is probably related to the age, et cetera. So I defer more to Dr. Etches about what her thoughts are on that. But as I said, we don't know yet if we're going to receive anybody or that be part of our inventory in the next couple of weeks anyway.
Yes, and I don't have any further provincial direction at this time related to the use of AstraZeneca. The province, I'm sure, will make that clear very soon, as they're going to be able to distribute it very soon.
Very good. Thanks a lot.
Thank you, Eric. We will now go to Josh Pringle at CTV Ottawa.
Thank you very much. My question is for Dr. Etches. British Columbia is extending the interval of vaccine doses up to 16 weeks instead of the 3 to 4 weeks. Does Ottawa Public Health and the City of Ottawa have any say on what Ontario recommends, or do you have to wait for provincial guidance on on how long to wait in between doses?
Ottawa Public Health is definitely following the provincial approach to vaccination with COVID-19 vaccines in Ontario, and so this would include the amount of time between the first and the second doses for COVID-19 vaccines that require 2 doses. So we know the recommendation and the science comes initially from the National Advisory Committee on Immunization, and then that provinces are looking at that evidence and that recommendation, and they're making their own decisions about the approach in the different provinces. And then our job is to implement according to the provincial framework.
And my second question, also for you, Dr. Etches. Today was the most concerned I've heard you in a while about the rising COVID-19 indicators in the city. Is it just the overall indicators that's a concern, or the fact that there could be 73 more variants testing positive as you go through the genetic sequencing in the next week that concerns you the most because it's a quicker spreading virus with the variants?
It's the overall picture, actually, the amount of COVID overall in the community that's growing. So we see that the wastewater, again, it's a pretty steep rise, and we're also seeing hospitalizations have gone up. So I always think of hospitalizations as a pretty firm indicator. If that's up, the COVID in our community is up. And the percent of people testing positive has gone up. So these are the things that are behind that concern in my voice. I know it's a challenge because we're in this balancing act for a number of months until we protect everyone with vaccine. I do have confidence we have the tools. With the variant, we don't yet in Ottawa see that it is spreading faster than the non-variant COVID variants of concern. I guess they're all variants. But that is the experience in other jurisdictions, that the variant does spread more quickly. And now we can see since the beginning of February with the testing of all positive samples that can be screened for the variants of concern, we can see it is here and it does have that potential to grow. I'm concerned when we see people are getting tired, and it's harder sometimes to keep going with limiting our contacts. And we see the mobility in our community, the people on the road, the amount that people are out and about has really increased. We can still live with the COVID in our community if we're not coming into close contact with people outside our household. So that's really the place to focus for all of us. It's our socializing, and to really pay attention, be careful, whether you're in a parking lot because your kids are at a hockey game, stay distanced from the other parents. Whether you're with a worker and you're having a smoke break, stay distant from that worker. Like there's these places that we just need to keep in mind. It adds up when we see each of us doing as much as we can. It's been enough to control the virus, and I just encourage us to keep with it.
Thank you very much. Moving on, we will go to Craig Lord at Global Ottawa.
Thank you. This is for Dr. Etches, I believe. Dr. Etches, on the variants, do we have any indication yet of where the transmission is happening? Are there signs that there's community transmission of these potential variants, or are the cases we think coming from outside international or even regional travel?
So what we see is 70% of the situations where someone's tested positive for COVID and then it's gone on to be screened positive for a genetic variant. It's related to either travel or close contact with someone who traveled, or a household contact of somebody who had the variant of concern. So close contact, household contact, or travel is 70% of the time. But that does leave 30% of the time. This is something people don't know the source. And so that's the indication of community spread.
Thanks very much. I think the follow-up probably for Anthony DeMonte. I was just wondering if we could get an update on the vaccination campaign for first responders. How many firefighters and paramedics have received a dose so far?
Yes, so for paramedics, 700 have received at least their first vaccine, and within that group, I think there's 400 that have their second vaccine because they were the first group of first responders. They fell under the priority healthcare workers group. Now the addition has been fire was next, and police. So for fire, we have a little over 1,000 that have gotten their first dose, and we have another 200 that are going to be scheduled for their first dose. And as we indicated, police are just beginning their process right now. They're starting to get scheduled through the Ottawa Hospital. So that's the overview for the first responders.
Thank you.
Thank you, Craig. Nous allons maintenant passer à Le Droit, Julien Paquette.
Oui, je crois que la question s'adresse à M. DeMonte. La semaine dernière, quand il est question des gens de 80 ans et plus dans les quartiers spécifiques où le taux de transmission est plus élevé, corrigez-moi si je me trompe, mais l'impression que j'en avais en sortant de la conférence de presse, c'est qu'on allait prioriser d'autres groupes de la phase 1 de vaccination avant d'en arriver à ces gens-là. Donc, est-ce que si on avait à choisir combien de doses étaient disponibles, est-ce qu'on croit être en mesure de vacciner tous ces gens-là finalement rapidement? Et puis si oui, d'ici combien de temps on pense pouvoir ajouter d'autres quartiers?
Oui, donc si vous avez quitté avec cette impression-là, notre communication n'était pas claire. On fait les deux groupes en même temps. Donc, c'est-à-dire les groupes de phase 1 prioritaires des gens de santé, etc., continuent et on met de côté assez de vaccins pour faire les 21 quartiers prioritaires. On commence avec 7 quartiers dont on a parlé avec 4 centres et on va continuer. On estime qu'on a assez de vaccins pour faire ce processus-là. J'aime pas trop normalement donner un temps parce que le temps limite, il y a toujours des problèmes qui surmontent et on veut s'acheter. Mais on espère d'avoir complété ces 21 communautés prioritaires de personnes 80 ans et plus d'ici la fin de mars. Je pense que c'est raisonnable. On est en mesure de faire ce processus-là et c'est de bonne vigueur. C'est en cours actuellement. Donc, d'ici la fin de mars, on devrait avoir complété ces centres prioritaires-là. Et également, peut-être rajouter, pendant qu'on fait ça, le reste du monde continue. Fait que peut-être on va avoir d'autres nouvelles. Est-ce que la deuxième dose, on va prolonger ce temps-là? Ça va changer un peu le portrait de ce qu'on va faire, mais pour l'instant, on a un plan et on continue à procéder à cet égard-là.
OK. Et l'autre question que j'avais, je ne sais pas encore une fois si c'est pour vous ou la Dr. Etches qu'elle devrait le plus s'adresser, mais vous avez insisté beaucoup aujourd'hui sur l'importance de laisser la ligne téléphonique aux gens qui remplissent les critères actuellement. Est-ce qu'il y a vraiment beaucoup de gens qui soient âgés de 80 ans ou plus ou pas? Est-ce qu'il y a beaucoup de gens qui appellent pour essayer de prendre rendez-vous, même s'ils ne remplissent pas tous les critères?
En fait, pas beaucoup de gens qui appellent qui ne respectent pas les critères. Je pense que les gens qui avaient des questions, c'était peut-être la communication n'était pas claire ou ils m'ont mal compris. Comme j'ai indiqué, on a eu au-delà de 2000 appels pour environ 600 ou 700 personnes qui ont été enregistrées, qui rencontraient les critères. Donc, ce qu'on veut, c'est qu'on ne veut pas que cette ligne-là soit embourbée avec des gens qui ne rencontrent pas tous les critères. On demande aux gens, s'ils ne sont pas sûrs, d'aller sur le site web de santé publique et de remplir l'information au niveau préalable. Et à ce moment-là, ils vont savoir s'ils sont en mesure d'avoir un vaccin ou non, si on les critères. Et si oui, à ce moment-là, de nous téléphoner. Fait que, non, c'était juste un commentaire parce que quand on continue, écoutez, on sait qu'il y a une grande demande. Les gens veulent avoir le vaccin. Nous aussi, Dr. Etches et moi, on aimerait beaucoup vacciner l'ensemble des gens de 80 ans et plus. On n'a pas encore le vaccin pour le faire. Dès qu'on va l'avoir, on a l'infrastructure en place pour le faire et donc on a hâte. Mais pour l'instant, on dit aux gens, s'il vous plaît, seulement appelez si vous rencontrez les critères, si vous avez l'âge, si vous restez dans le quartier, etc. Et comme je vous dis, au-delà de 2000 appels téléphoniques pour vraiment 700 personnes qui étaient en mesure de vraiment... c'est un peu plus que normal, mais ça n'a pas créé de problème et l'équipe est en mesure de répondre à l'ensemble des appels.
Parfait, merci beaucoup.
Merci beaucoup, Julien. We will now go to Elizabeth Payne at the Ottawa Citizen.
Thank you. I think my question is for Mr. DeMonte. I'm just hoping you can help me understand what happens in March now for over 80s. The province said last week that as of March 15th, its registration system opens. People can register and sort of for mass vaccinations. Now you're suggesting that's not going to happen. Can you spell out what happens for, yeah.
Yeah, I don't know if I'm suggesting that's not going to happen. As it currently stands, we have limited capacity to target that population. So we've used, as Dr. Etches says, an evidence-based scientific approach where we've targeted the most critical communities and neighborhoods, and we're marching through that. I think from now to the end of March, as we're seeing daily, the world is changing. Today we have a new tool in our toolbox, a new vaccine. Dr. Etches indicated that we're waiting for the scientific group to say whether we're going to continue doing vaccines in the same time frame. If it changes to 4 months, you can quickly understand that that completely changes the picture. And in simple terms, I know we're going to probably get more vaccine weekly, but to explain that in simple terms, we get somewhere in the neighborhood every Tuesday, a little bit more than 9,000 vaccines. And we have to put aside second doses. We have to put aside a group for our new priority groups, for our first responders, that type of thing. In that new world, if we move to 4 months between vaccines, well, suddenly now we can use that those 9,000 vaccines for first vaccines for brand new people every week, which would be completely changing our picture. And we're looking at that, and we're ready for that if that happens. So I think, just to put things in perspective, I think no, it's not really a question of not wanting to do it. So we're going to continue to march down and continue to do that priority group with the vaccines we have. And as I said, I think to another colleague, the fridges are bare every week when we finish our week of vaccination, and we're looking forward to getting our Tuesday supply.
Okay, thank you. I have a follow-up, an unrelated follow-up for Dr. Etches, if you can help me with it. It's a question about the variants. Currently, they get screened here, correct? And then they get sent to the Public Health Ontario labs. And how long does that process take? And does that slow public health's ability to trace or better understand what the situation is with variants in the city?
Yeah, so let me just clarify, because I think I nodded my head at the wrong time here. So the people who are tested for COVID at the assessment centers, at our school, based testing for asymptomatic people in the school community, they are, all those samples are sent to the Eastern Ontario Regional Laboratory Association, and that's where we're getting the results back. I mean, 71% of the time we're getting them back in less than 24 hours. That lab then, when they're positive, is sending them to the Public Health Ontario lab for the screening for the variant of concern. That is going to shift over very soon, actually. I think this week, the Eastern Ontario Regional Laboratory Association will do that screening for the genetic variation that's of concern. Still, once the screening is done, they will shift them to the Public Health Ontario lab for the sequencing, the genetic sequencing. That's the way to really confirm it's a variant of concern. And that sequencing can take a while. It can take many weeks. But fortunately, the way we address the situation, our case management and our contact tracing and our outbreak management is not dependent on knowing whether it's a variant of concern or not. We're actually treating everything as if it could be a variant of concern. In most cases, that's the thinking in our head. The ways to control transmission are the same. We need people to isolate if they're a high-risk contact, all of these steps. And we are also treating, as I mentioned today, the screening positive result as likely going to turn out to be a confirmed variant. So that is the case most of the time. So I hope that answers your question.
That does. Thank you.
Thank you very much. We will now be going to Laura Egertson at Ottawa Magazine. Laura, you may be on mute. All right, Laura, if you're having technical issues, please email the media relations team. We will now be moving on to Bruce Dietzman at the Ottawa Sun.
Hi, can you hear me? Hello?
Yes, we can hear you great.
Okay. I think my question is for Dr. Etches. When you talk about these sort of disturbing trends in the indicators and how they're sort of going the wrong way, and the other things you look at, the hospitalizations, the wastewater, I'm curious, if you put all that into a timeline, how problematic is it, and when would it look like if we don't do something, we might head back into the red?
Well, what we're seeing is usually a bit delayed, even in the wastewater, because the people who are shedding virus had to have been exposed and then incubated the infection and then developed symptoms and virus shedding, that probably is a delay still of about a week or maybe less from the time of exposure. And so, it is still after the fact. It means people also out there, they aren't being tested. They're not knowing they need to isolate. It goes on, the transmission goes on. So I'm concerned today. The good news is today, what we do, if we stretch out the distance between each other and commit to those careful behaviors, we will see improvement in 2 weeks. But I do think, in that period between now and 2 weeks from now, we could easily tip into red. Yeah.
Okay. And is all of that on us to do something about?
We are all working on this, public health, workplaces, schools, everybody has their role to play. But what we've seen repeatedly that makes a difference, and I'm talking about Ottawa, about our city, what makes a difference in Ottawa is individual behaviors and the socializing, the social contacts. We have, a little bit more control, I think, over when things go up and down in Ottawa, because we're not seeing the same kinds of larger workplaces that have different kinds of challenges. So it is a call to all of us to do our part, because our decisions do make a difference. We've seen that over and over again. At the same time, Ottawa Public Health is working hard to make sure that we are making it easy for people to be tested, and that we're using tests in different ways. We're promoting rapid testing in workplaces through different work settings, because there's a provincial program that allows that now. We're looking for COVID in the school communities. We'll continue to do this. But again, that's after the fact. Transmission's already occurred. We need to, the most effective thing to do is just stop it from going from person to person in the first place. And, it's good it's under our control. It means there's something we can do about it. But it's not easy. It's not easy after a year. I do want to encourage people, the vaccines are coming. It's just a few more months we need to do this. And I think, I have confidence that we'll make it through.
Thank you very much.
Thank you very much, Bruce. Finalement, nous allons passer à Émilie Bergeron à Radio-Canada.
Oui, bonjour. J'ai une question pour Dr. Etches. Vous avez parlé un peu de ça en anglais, mais j'aimerais vous entendre aussi en français. Vous avez parlé de votre inquiétude d'un retour en zone rouge. À Ottawa, il nous reste combien de jours pour juger si ce sera nécessaire un retour en zone rouge? Avec les indicateurs que vous voyez en ce moment, on a un jeu de combien de jours à peu près pour devoir décider si oui, là, il faut aller en zone rouge?
Le point que je voudrais faire, c'est que c'est important aujourd'hui de faire attention à notre action pour avoir bonne prévention de la transmission de la COVID, parce qu'aujourd'hui, les chiffres reflètent la semaine passée. Et notre action aujourd'hui peut changer la situation dans 2 semaines. Mais entre les 2 semaines, comme ça, on a vraiment la possibilité de passer à la zone rouge. Parce que la situation dans l'eau usée, c'est un indicateur plus tôt, et c'est encore une augmentation vite.
Et ma deuxième question, ce serait pour M. Dimonté. Les 7 centres de vaccination dont vous avez parlé la semaine dernière, qui peuvent être déployés, si ma mémoire est bonne, en l'espace de 72 heures, là, dès qu'il y a assez de vaccins. Je sais que votre message, ils vont être prêts à être déployés dès qu'il y a assez de vaccins, puis on ne sait pas quand ils vont en avoir assez. Mais avec la nouvelle d'AstraZeneca qui est approuvée maintenant, est-ce que vous avez une meilleure idée? Est-ce que ce serait, qu'est-ce qui est envisagé à partir d'avril qu'on pourrait ouvrir ces centres-là? Quelle est votre cible ou votre objectif?
On n'a pas une cible encore identifiée. Oui, on a un nouveau outil AstraZeneca est maintenant au Canada. La province, comme j'indiquais, doit décider comment qu'elle va distribuer ce nouveau vaccin. Et on attend des nouvelles à savoir si ça va être un vaccin qu'on va avoir à Ottawa. On a actuellement 2 vaccins. Est-ce qu'on va avoir le 3e? Avec les chiffres que j'ai vus de ce qu'on a reçu, 500 000 doses au Canada, la distribution se ferait le restant à travers la province. Je ne crois pas que c'est assez pour l'instant d'ouvrir un des centres. Et donc, on continue à faire un monitoring, si vous voulez, de l'ensemble de les doses qu'on a et notre capacité. Le plus tôt qu'on peut, on va les ouvrir. Et c'est pas nécessaire d'ouvrir les 7. On peut peut-être ouvrir 1 ou 2 ou 3 centres. Et si c'est seulement en termes de volume qu'on a. Donc, on fait cette analyse jour à jour. Et comme j'indiquais tantôt, si les choses changent, on va les ouvrir le plus rapidement possible. Parce que l'objectif, c'est d'être en mesure de vacciner beaucoup de personnes à travers de ces centres-là versus ce qu'on fait actuellement. On utilise tout notre vaccin actuellement avec les méthodes qu'on a. Donc, c'est pas nécessaire d'ouvrir les grands centres pour l'instant.
Merci beaucoup à tous. Thank you, everyone. This is all the time that we have today. C'est tout le temps que nous disposons aujourd'hui. Bonne journée. Have a great day.